All right, so Trump held a nearly 2-hour press briefing the other day, and I boiled that down to the most interesting parts. Let's take a look and see what happened.
Every segment of our society to turn the tide in the battle against the virus. I want Americans to know that we will get through this challenge. The hardship will end. It will end soon. Normal life will return, and our economy will rebound very, very strongly. But right now, in the midst of this great national trial, Americans must remain united in purpose and focused on victory. To every single American, please know that the sacrifice you're making at this time is saving lives, many, many lives. It's very important that we totally protect our Asian American community in the United States and all around the world. They're amazing people, and the spreading of the virus is not their fault in any way, shape, or form.
So a couple interesting things there. This is the first time that Trump hasn't started off by calling it the Chinese virus. So he's actually now made a complete U-turn, and now he's saying we need to show respect and civility towards Asians. So it's just kind of an interesting turnaround that's happened all of a sudden. Also note that he's saying, because we'll see a little bit of a turnaround on this issue as well. He's saying that the efforts that the American people are doing by staying home, not going out, we're distancing ourselves, social distancing, is helping. It's making a difference, right? So let's keep that statement in mind throughout the rest of the discussion.
We also have a large team working on what the next steps will be once the medical community gives a region the okay, meaning the okay to get going, to get back. Let's go to work. Our country wasn't built to be shut down. This is not a country that was built for this. It was not built to be shut down.
Okay, so that sounds innocuous, but when it's put in context of the rest of the statements that he's going to make, you'll start to see that maybe it's not quite as plain as it sounds right away. It makes sense. Okay, we're going to go through this. Everyone's going to shelter at home, and then eventually we're going to come out the other end, and everyone can start going to work again and socializing and going to parks and beaches and the things that we're not supposed to be doing right now. So it makes sense. Yeah, at some point the government will give us an indication about what we can do and when. Except as you'll see throughout this discussion, he's going to start sneaking in that we really need to start pushing it. We really need to put the economy in front of the fact that some people are going to die. So notice that we started off with him saying, yes, everyone's staying at home, doing the right thing. Now he's starting to put a little bit of an emphasis on, yeah, we have to pay attention to the economy. The country wasn't meant to be shut down like this. And then you'll hear some statements coming up where it's really starting to push, we need to get businesses running again, which obviously is important, right? It's very important that we get businesses running as soon as possible, but the question is at what cost? What number of lives is the acceptable number of lives to be lost in order to get that economy going?
My administration continues to work with Democrats and Republicans to reach an agreement on an urgent relief bill for the millions of American workers and small businesses and large businesses that were badly affected by the medical difficulty that we've had. If you had a viable business in January, we are committed to ensuring the same is true in the coming weeks. In fact, we want to make it even better than it was before, and we're doing things to help in that regard. America will again and soon be open for business, very soon. A lot sooner than 3 or 4 months that somebody was suggesting. A lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
All right, and there we see it. You're going to hear this so many times. We can't let the cure be worse than the problem. In other words, we're all staying at home to save lives, but that's hurting the economy. So, we can't let this cure of staying at home be worse than if we all just went to work. So it kind of depends. Are you a billionaire who needs the economy to keep flowing? Or are you a human who needs your body to keep working? Who needs your lungs not to shut down on you? That's kind of the question, right? I mean, so you'll hear this a lot. It's this balance between lives and money.
I want to take a moment to thank the everyday heroes who are making our vast effort against the virus possible. And thank you to the healthcare workers and the first responders. These are very brave people. Thanks also to the hardworking men and women of Federal Express, UPS, the United States Postal Service, and the truckers who are maintaining our supply chains and supply lines. We thank you very much.
See, this is something that bothers me a little bit about the way our country runs, is it seems to be enough to stand up and say, we want to thank these people, and then that's it. That's all they really get. It's very easy to say thank you. It's much more difficult to actually show a thank you, right? Everyone you talk to is all about the troops and taking care of the troops and, standing up and saying, I support the troops. But then when those troops come home, are we really taking care of them? Are we helping them adjust to everyday life? Are we making sure that they're getting the medical care that they need when they come home? Well, those things are expensive. I don't know if we can support them in that way, but we can say thank you and we can stand up before a sports event, and that's showing how much we care about our troops when people are coming home with PTSD, but we say, hey, thanks for what you did, but we don't really take care of them. And I feel like it's the same thing here. We're acknowledging all these workers. We're acknowledging the people who are working at the grocery stores right now. We're acknowledging the nurses and the people who are taking care of the sick and the delivery truck drivers and all the people who are keeping the country moving so that we can still buy food while we're all sitting at home. So it kind of gives you some insight into who are the real essential employees of this country, right? And we've gone to a situation where it's very easy to not support those people. The grocery store clerk or the truck driver. Maybe if we really appreciate the work that these people are doing, maybe they should have health care. Maybe they should have a wage that supports, the amount of respect that we're saying that they deserve. And we should make sure that they have that. So, I guess I would push back on this issue that's being brought up of it's very easy to say thank you to people. It's a lot harder to show them that you actually meaningfully thank them by giving them the things that they should have. Healthcare, a living wage.
That while the president has published at coronavirus.gov the 15 days to slow the spread for every American, and millions of Americans are addressing these common sense guidelines to prevent the spread of the coronavirus.
So you're going to see this a few times, and it just kind of makes me smile each time. It's like they're selling a product, and they each got trained on how to be a good performer in an infomercial before they came out to give this. They all bring up the envelope, and they show the envelope side by side. They give it the name, the 15 days to separate, or whatever they called it. And they always refer to that like that's the big plan. That's what's saved the country so far. And that once that 15 days is over, we should really be ready to start going back to work, right? Throw everyone back in there. We took 15 days off. The problem is solved. We still have countries around the world that are losing 600-700 people a day. The count in this country is growing up to over 200 we lost the other day. But hey, once that 15 days is over, that's all the economy can take. And they keep showing that envelope every time to make sure you understand that plan of the 15-day social distancing. And that's enough. That's all that we needed.
We are now 8 days into the president's 15 days to slow the spread.
So here he goes again. 15 days to slow the spread. Show the envelope. Make sure everyone can see it. Make sure they understand the product that we're trying to deliver to them. Make sure you say the name. 15 days to slow the spread. And everyone's going to buy it.
So yeah, it's bad, and it's going to, obviously the numbers are going to increase with time, and then they're going to start to decrease. And we're going to be opening our country up for business because our country was meant to be open and working with others, but especially for our workers. And the engine for that whole system is we have to have companies, and these companies are loved by our workers because they're paying big salaries and big dollars to our workers, and we're going to get it all going again very soon, hopefully very, very soon. Please.
Sir, I'm just trying to reconcile the two things that you just said. One, that things are going to be very, very bad, and two, that you want to get the country open back up as quickly as possible. So I guess my question is, if in a week, Dr. Birx or Dr. Fauci are telling you we need to continue these measures for the health of the vulnerable populations of the country, are you going to say, I'm sorry, the economy is too important?
Well, you'll see what happens. I understand the question very well. It's a great question, but we can do two things at one time. I will say this: our country's learned a lot. We've learned about social distancing. We've learned about the hands. We've learned about staying away, at least during the time that this is even a little bit around.
So he said a bunch of things there. Numbers go up, numbers go down. Well, we're talking about death rates here. So yeah, numbers go up, numbers go down. I think it takes a little bit more effort than that. Yeah, we're talking about people's lives. But then, hey, we got to get them back to work. The workers want to get back to work. That's what we're being told. The workers want to get back in there, right? And it just seems to really show a preference of they have to get back in there. We live in a country where the main things that we produce in this country, billionaires and poverty, right? Well, those two things have to go together. We can't keep the billionaires rich if we don't keep the poor people needing to get back to work. Okay, so, you kind of, which is it? He likes to have both at the same time. We're working hard to keep people safe, but we really need to get those workers back to work. And by the way, the workers want to get back to work. They want to get back in there because they love the company so much that they would hate for the company to have a slowdown. They got to get in there and risk their lives, potentially dying because they went to work. So this is one of Trump's phrases that he keeps going to. Two things at one time. We can do two things at one time, as if the two things are like, steaming broccoli and cooking a burger. Well, yeah, you can probably do those two things at the same time. If the two things are keeping people isolated so that they're all safe, and the other is sending everyone back to work, you can't really do those two things at the same time. So he says this all for the whole 2 hours. He keeps repeating, we can do two things at some time. Sometimes he even raised it up to, we can do three things at a time, or even, I think once he said we can do four things at a time. But most of the time he's saying we can do two things at a time, and what he means is people have learned about social distancing. He mentioned the hands. In other words, we shouldn't be shaking hands. So as long as we don't shake hands, everyone can go back to work and keep the rich rich. We can keep the economy rolling. You can't do both at the same time. You can't do both at the same time, mainly because they oppose one another, right? If we keep everyone separate, social distancing, it's pretty hard to send a bunch of people back to work, right? In many, many instances.
But at the same time, at a certain point, we have to get open and we have to get moving. We don't want to lose these companies. We don't want to lose these workers. We want to take care of our workers. So we'll be doing something I think relatively quickly, but we've learned a lot during this period. This was a very necessary period. Tremendous information was gained, but we can do two things at one time. And again, I say we have a very active flu season, more active than most. It's looking like it's heading to 50,000 or more deaths, not cases, 50,000 deaths, which is, that's a lot. And you look at automobile accidents, which are far greater than any numbers we're talking about. That doesn't mean we're going to tell everybody no more driving of cars. So we have to do things to get our country open. But this has been an incredible period of learning, and we'll have announcements over the next fairly short period as to the timing.
Okay, so here's part of the issue. He keeps saying, it's like the flu. We're losing 50,000 people for the flu. We haven't lost anywhere near that number of people. We're basically crossing 1,000 people in the U.S. dying because of the virus. He's talking about how 50,000 people die from the flu. Well, it's a little bit different. As you'll hear later in the conversation, he talks about how the death rate is around 1%, although he tries to talk it down much, much lower. But there's a couple things wrong with that 1% mark as being the fatality rate for people with the virus. One, we have 330 million people in this country. So 1% of 330 million people is 3.3 million. That's a lot of people. That's way, way more than 50,000. The other thing to keep in mind is that 1%, slightly below 1% fatality rate, is when the hospitals are still able to work at capacity. Okay? Once we start overflowing the hospitals, once we've overflowed, we've run out of ventilators, we've run out of nurses and doctors to take everyone, that's when the death rate shoots up to 3-4%. So then you're talking about even more people. And it just we go over capacity, and you can't take care of people. And when you're not taking care of sick people, that's when they start dying. So his math really doesn't add up in this situation. And unfortunately, this is a case where doing your math wrong means people are going to die. There's going to be a situation in this country, because looking back at these kinds of things, you have all the information. Trying to look forward at what we're doing now is difficult because the scientists are still learning about this. But there will be a time 6 months from now, a year from now, when the scientists are going to have all the information, and they're going to be able to look back and say, if Trump had implemented social distancing and a lockdown in January when we knew about this, then the death rate would have been this a number. And then we'll compare that to the actual number of people that died, and you're literally going to be able to have a body count and say Trump's decisions led to this many people dying. And it looks like a lot, because when you hear the experts talking about this, they're all saying America is about to get hammered. In the next 2 weeks, those numbers are going to skyrocket, and they're going to stay up there if we don't start actually following the rules. But by Trump coming out and saying, hey, maybe by Easter, maybe in the next couple of weeks, we're going to loosen things up, that gives people permission to start loosening up now. Plus, all the experts are saying there's no point in ending it in a couple weeks. It's going to be a mess. It's not going to work.
John, please.
Mr. President, I want to ask about these guidelines on testing. Obviously, Senator Rand Paul has tested positive for coronavirus, but he was not in contact with anybody who was a known positive, and he didn't have any major symptoms. Under your guidelines, under the guidelines that have been outlined here, he would not have gotten a test. He got one anyway. So what do you say to him? He's pointed out that if he hadn't gone basically in defiance of these guidelines and got tested, he might still be showing up to the Senate right now and infecting the whole U.S. Senate.
So that's why this was important. That's why this recommendation to the American people was important. Because we have been saying that there is a level of asymptomatic or mild spread. And that's why each person has to be responsible. Each person has to be responsible in the way that they decrease their interaction with others, the 6 feet.
So notice the envelope, 15 days to slow the spread, right? It's like we're being sold some kind of club that we all have to buy into. So 15 days to slow the spread, and personal responsibility. This is kind of her big mantra, personal responsibility. We're going to send you all back to work, but you better take personal responsibility. We're going to send you back to work, but you better do your social distancing, which of course we should all be doing, and hopefully we are all doing. But this has been shown to be a very, very contagious virus, right? Just take a look at New York. People were walking around New York giving it to everyone for 2 weeks. So yeah, would social distancing help with that? Of course. But this idea of, hey, it's all on you, go back to work, and as long as you don't shake everyone's hand and you're taking your personal responsibility, then you should be just fine. If you listen to the doctors, they're saying, not so much. And notice that Fauci's not there today. Notice the absence of Fauci. That actually came up as a question. Where's Fauci? Why isn't Fauci here? Well, that guy's kind of telling it like it is, and I don't really think the 15 days to slow the spread is going to do it. With most of these experts are saying it's complete nonsense.
We can just keep with the example of Rand Paul, and obviously there are many other people that would be in a similar situation, but just keep with this one example. If he hadn't gotten that test, he would still be showing up to the Senate every day, to his place of work.
If he had
You
been
wouldn't want that,
following
would
these
you?
guidelines, he wouldn't have been infecting others because of the social distancing, washing your hands, doing everything that we talked about. So we've talked about also how people make choices because of their jobs, that they have to come in. You'll notice I was not here over the weekend. I think this is the part that we really need to take personal responsibility for. Saturday, I had a little low-grade fever.
Uh-oh.
So, actually, probably a GI thing. But I'm meticulous. I'm a physician. I looked it up. I ended up piggy bank. I'm from Walter Reed, so I got a test late Saturday night, and I'm negative. I stayed home another day just
Thank you for saying that.
yeah, just to make sure. That's how we protect one another. So, you know, unless everybody's taking their temperature every day, we can't say that he had no symptoms. These are the kinds of things that we have to do for one another. This is the personal responsibility that I'm talking about, that we all have to practice.
And Mr. President, when you say you don't want the cure to be worse than the problem itself, so are you saying that if we kept these measures that we're doing now in place for a couple of months, 2 or
Well,
3
they
months?
will be in place. At some point, we're going to open up our country, and it's going to be fairly soon.
Weeks or months? Because you seem to be
I'm not
leaning more
looking
towards-
at months, I can tell you right now. We're going to be opening up our country.
Low-grade fever.
Okay, so again with the personal responsibility. So she shows the envelope again. Personal responsibility. Come on, when you go out in public, how many doorknobs are you going to have to grab at your job? And you can't go wash your hands every single time you touch a doorknob, okay? Sometimes you got to touch a door to get in and out of the bathroom, okay? There's stuff everywhere. It's not realistic that we're going to all be able to go back to work and social distance at the same time. Some of us work in places where there's a high density of people. It's more than just taking personal responsibility. So a couple things there. One, did you catch Trump with his comedic bit? She said she had a fever and he bounced out of there jokingly, right? It was actually kind of amusing. But then she goes back to the personal responsibility. Apparently we're all supposed to be taking our temperature every day, right? Well, many people aren't able to do that. Many people don't have the equipment to take their temperature every day. Many people are not equipped to take their temperature every day. Sure, it'd be great, but the truth is sometimes people's temperatures just vary for nothing to do with this virus that's going around. In fact, she just said that. She just said that she had a fever over the weekend and then thought that maybe she had it. It turned out to not be. So people's temperatures fluctuate just in general, right? You eat something that doesn't quite agree with you, your temperature goes up a little bit. So this idea that, well, if we're all just taking our temperature at home and then we stop shaking hands, we'll be fine. Yeah, I'm sure. Okay, so he hasn't actually said Easter yet. He actually said that the following day. But he's now saying it will be weeks instead of months. I've listened to a lot of shows where there are experts talking about this, and I have not heard any of them saying, oh yeah, if the US just stays put for a couple of weeks, everything will be fine. They're all like ringing the alarm bells saying, this is very, very bad. You all need to take this very seriously or you're going to be worse than Italy. And by looking at the numbers, it looks like we're on our way to passing Italy. So here he is already pushing this, couple more weeks, and then we need to get people in there. And if some old people die, well, that's the sacrifice that needs to be made for the economy. The economy, by the way, which isn't working for many of us. Right? The workers, the people who actually have to go to work. Do you think the CEOs are going to be walking among the floor of all the sick people? No, they're going to be up in their high-rise office, secluded from everyone, with their own bathroom where they can wash their hands as much as they want, and no one else uses their bathroom. In the meantime, the rest of us are all infecting each other. Come on. Are we more concerned about people or money? When we get through the end of this, we will have a country full of people who want to get back to work, who want to get the economy up and running, who want to achieve things, right? And if we still have all the people, then we can do that work together. If we let all the people die so that the rich people don't take too much of a hit, we're not going to have people, right? What's the point of the companies if we've lost too many people?
And we're going to be watching certain areas, and we're going to be practicing everything that Deborah's referring to right here. I mean, we're going to be watching this very closely, but you can't keep it closed for the next, for years.
So apparently the choice is either 15 days or years. There's no in between, right? There's no such thing as months. Right, which seems to kind of be what people are saying is the Chinese actually got a hold on this by shutting everything down for an extended period of time, and now they're doing much better. If you compare their rates of people dying each day, they're doing better than we are. So, perhaps months is the right answer. It'd be good to get back to work if we could all get back to work, but when the scientists are screaming at us 15 days to slow the spread is not going to cut it, maybe we should be listening to them.
And we fixed a lot of problems. One of the things we fixed is, if you look at the obsolete system that this administration inherited, it wasn't meant for this. It was meant for a small group of people, and even for that, it was not very good and very obsolete. We now have a testing program now that will hopefully be able to be used for many years into the future. Should we have another event like this? I don't think you'll have another event like this.
All right. A few things going on in that short clip there. So first of all, let's remember that after Zika and Ebola, the Obama administration built up the pandemic response team, built up that part of our government agency that monitors all this kind of stuff and is in the other countries monitoring what's happening. In the Trump presidency, so during the Trump presidency, right, he wants to keep saying, oh, we inherited this system so he can push blame back to the previous administration. It was under the Trump administration in which all of those things were cut. Doctors were cut, programs were cut, we sent them all doing other things. Remember Trump saying, hey, I'm a businessman, I don't like having all these doctors around that we're not using, paying for doctors we're not using, and he said, we can hire them back real fast when we need them. Well, none of that's turned out to be true, and to cover up for it, he's got to say, well, we inherited this problem from the previous administration. Well, also, you've had 3 years to build it up on your own. If you thought it was insufficient, then why, instead of cutting all those programs, why didn't we build them up into something that would actually work again? And the fact that he doesn't get it, right? Oh, I don't think this is going to happen again. This is just a one-off thing. Well, yeah, the Spanish flu was about 100 years ago, but if you look, we have had outbreaks of other things in the meantime, except what happened? We had teams in place watching it. Now, granted, every outbreak is different, but we had teams in place letting us know what was happening. We could respond. Instead, we decided to gut all of those programs because Trump doesn't like to pay for doctors who aren't doing anything. All right, so this next part I just threw in here because I find it very bizarre. I can't quite figure out what's going on. They stop paying attention to the fact that this is a press conference and there's press in the room, and Trump starts asking his own people questions. He starts coming up with his own questions and asking the doctor questions about pretty basic stuff that it's like, how are we this far into a pandemic and you don't know the answer to these questions? And it's just a very strange moment that kind of gives us a little bit of an insight into the president's mind. And it's scary. It's a little weird. It's unsettling.
I have a question for you. So we have a lot of very angry media all around this room, and they want one of these seats. But because of social distancing, we are keeping them empty, and they are keeping them empty. Will there ever be a time when all of those really angry people who don't like me much to start off with, but now they really don't like me, will there ever be a time when these seats are full to the brim like it used to be, where people are almost sitting on each other's lap, and this whole row over here is packed, and now they're outside wanting to get in, and they're very jealous of all of these reporters? Will we ever have that again, or is that something that will be, it'll look like this forever?
So we're learning a lot about social distancing and respiratory diseases.
So I honestly don't know what that question was about. I actually thought at the beginning he was threatening them. He was using it as a threat. We have these angry reporters. They're in such a bad mood and they're so mean to me. I thought he was trying to sort of threaten them that if you don't all fall in line and start asking me the right questions, I'm not going to let you back in here. But I don't actually think that's what he was doing. It sounds like he just was, I don't know. I do not get this moment in the press conference. He's the one arguing that we should all get back to work, that we should all go back to normal, and yet he's unsure if they can ever get more than half a dozen reporters inside to a press conference again, and it's weird. I don't know.
And I think those are the discussions we have to have in the future. It was what you were talking about, changing our whole behavior patterns of what we touch and being conscious of that. I remember when I was worried Saturday morning, I was trying to think, what all did I touch on Friday? Did I touch a doorknob? Did I do this? Did I do that? Did I not wash my hands? I mean, you go through this whole piece. Did I touch my face by accident? So I think this awareness that we all now have that we didn't have before, where we would have pushed through that door or turned that doorknob because we were in such a hurry. Now I think all of us think twice. I think all of you think twice.
But when the virus is gone, will the people be allowed to sit next to each other again, in your opinion, in a tight room with a tight...
I don't know. You'll have to look and see if we have a new respiratory piece. Certainly, this is the way we set up every clinic all around the world when we're worried about TB and TB transmission.
Again, so he actually brought her back to this question. Will we ever be able to have people sitting in the seats again? Or are we just going to social distance for the rest of eternity? Even though I'm trying to get you all back to work, which will be perfectly fine, but when you're angry reporters in the room trying to ask me questions, then maybe we need to have you all spread out. It doesn't make any sense.
Does he agree with you about the need to reopen the economy soon?
Well, he doesn't not agree. I mean,
Okay, that was just an amazing question. So again, it was another form of them asking about doctors agreeing with Trump about getting the economy going being more important than potential lives. And he was asked, does he agree with you? And the answer was, he doesn't not agree with me. What are you going to, I mean, there's not much to say there. It's a bizarre way to answer a question. If you ask someone in real life a question like that, do you agree on this? And their answer was, I don't not agree. It wouldn't leave you with a good taste in your mouth, right? You'd be, what? What is this person trying to do? Is this person trying to scam me? What's going on here?
Sure. And if you look at the second page of 15 days to slow the spread, you'll see the president's recommendation for this 15 days is for people to stay home from work.
Yep, show the envelope, 15 days to slow the spread. That's all we were ever planning. That's all we ever needed. 15 days is almost over. Let's get ready to get back to work. Show the envelope, say 15 days to slow the spread.
As the president said, at the FDA has done a remarkable job going through the review and approval process for these new methodologies really in record time. We reflected a little bit ago about the fact that we're pretty sure we set a record. I think it was 62 days to be in the phase 1 clinical trials of a vaccine that's actually in clinical trials today.
So this is a talking point I'm getting a little bit tired of, because first of all, he said we set a record, and then he said he's pretty sure we set a record. But either way, you better have set a record, right? In normal everyday trials, we're more concerned about just following every rule, crossing every T, dotting every I to make sure everything is completely safe. We have people dying ongoing, and we need to get things moving forward. So if you didn't do it in record time, the big question would be like, why aren't you moving faster? Why aren't you setting a record for getting things out as fast as they can? It shouldn't really be a point you brag about, hey, we did this in record time, or maybe you mention it once, but to keep going back to this point and hammering it again and again. We put this through in record time. Of course you did. There's a world pandemic and hundreds of people are dying every day. You should have done it in record time. It's not something to brag about, right? It's like if your house is on fire and you're like, yeah, I got up and I left the house. Yeah, of course you did. That's what you do in that situation. When there's a global pandemic, you move kind of fast. That's your job.
Just my other question for you, I just want to get clarity on this. If we get to next week, you're deciding what to do with these guidelines, whether to ease them or reinstate them for another 15 days. Will you follow the advice of Dr. Birx and Dr. Fauci if they say you should maintain them for
and
2
others,
more weeks?
yeah. And then ultimately I have to make a decision. But I certainly listen to them. I listen to a number of people. And I have a lot of respect for Dr. Fauci and for Dr. Birx. And I'll be listening to them and others that we have that are really doing a good job. John?
But are you worried that if you do this too quickly, if you lift these restrictions too quickly, the virus will start spreading unabated? And how can you be sure that that's not going to happen?
Well, you know, we have now a system, and the system's in place. And
So again, another version of the question being asked, are you going to listen to doctors, or are you just going to tell us all to get back to work? And he can't just say, yes, our number one concern is the safety of citizens. That is the most important thing. Even if it isn't your most important concern, you're supposed to say it's your most important concern, but he can't even do that. He's just got to, yeah, I'll listen to the doctors, but I'm also going to listen to other people too. There's other people besides doctors that need to be listened to. CEOs, corporations, shareholders, board members, all these people need to be listened to. And also we'll listen to the doctors. And we'll make a decision based on that.
But one of the things is the mortality rate, John. When we first started this, nobody knew anything about this particular virus. Very, very little. I mean, we started off, we were hearing numbers of 5%. That's an astronomical number when the flu is 0.001 and 2 and 3, right? And so 5% would be an astronomical number. Now we're seeing numbers that may be less than 1.
So again, he's talking about 5%, but these numbers, you can't compare the situations in different countries, and you can't compare when you're below capacity for the healthcare system versus when you're above the capacity for the healthcare system. Yes, we are currently seeing a less than 1% death rate, but that's because the doctors and the nurses and everyone can still handle the cases that are incoming. If we reach a point where we can't handle that because so many people are coming in, you end up with a situation like Italy, where they're reporting people dying in the hallways of hospitals, and you just can't, you don't have enough people to deal with them. Their people are dying too fast. We don't want to get to that point. We want to keep it at the under 1%, and the way you do that is by not spreading the disease to everyone at once. You spread it out, right? We're all hearing that term about, lowering the curve. That's why. We don't want everyone going into the hospital at the same time.
You just mentioned that there were some things last night that were unacceptable, which would have been bad for the country, that the Democrats were bringing into the stimulus conversation. Her question was, what provisions would you absolutely not support in this plan right now?
Well, a lot of the provisions that they wanted, like stock buybacks, I agree with that. That's good with me. I mean, I don't like them buying back stock. I like them spending money on airplanes and on their employees and their real business, not buying back stock. And I don't know if that provision is going to be put in one way or the other, but I'm all for it. And many Republicans, I can tell you, are for it, and I think many Democrats are for it. But they were putting that out like it was a problem last night. Not a problem for me, I can tell you that.
Okay, I put this in here as a good on ya, right? I bash on Trump a lot because he does a lot of stuff that drives us crazy. But this is a case where he seems to have his head in the right place, right? Yes, we're not going to give money to companies so they can buy back stocks. He's agreeing with that, so I'm saying, good. I'm giving you credit, Trump. I'm glad that in this one instance, you're doing the right thing. Nice.
Which was quite a while ago now, because again, we're trying to answer every question, so there's no, it'd be nice if you were just exhausted and said, that's it, we can't do anymore, but there's always hands up. But, and maybe one of those questions is great and unique.
Again, weird. He was answering a totally different question, but he still kind of had to stick it to the reporters that were in the room, right? Your questions are all repetitive. They're all the same. Come up with something unique. It's just weird to throw that stuff in there. I don't know.
You and the Vice President have been tested for the virus. Also, Mrs. Pence. Has the First Lady been tested?
Yes.
And?
She's great. She's fine.
Negative?
Negative, yes. Okay? Negative.
I just like this moment. Again, it's not going to change the way the world works, but it's just interesting to me. Normally, when he's asked a question, he just goes on this stumbling train of thought, rambling answer that, these sentence fragments that don't really go together, have one sentence doesn't have anything to do with the sentence that came before it. And this is one of the few times where he just seems to have no idea how to answer the question. Was your wife tested? Most husbands could answer if their wife has been tested for a pandemic that's sweeping the globe, and he seemed to really have to think about it, and then he just threw out the answer he thought was supposed to be the right one. I don't know. I don't have a whole lot of confidence in that answer. Doesn't really matter. I don't know why we care if she's been tested or not, but it's weird that he doesn't seem to know, and it's weird that why was this the question that really kind of stumped him and he didn't have an answer for it? It's weird.
One of the sticking points on the stimulus, who's going to hold Treasury accountable for this $500 billion corporate rescue fund?
Well, you need that to help all of these companies that have a chance of not being companies anymore. And that's going to be a good thing for the country because deals will be made, and we're talking to certain people, some of the greatest people in the history of Wall Street, frankly, where when they do a deal, we'll have stock for America. We'll take back stock for the United States. At the same time, most importantly, we'll keep those companies healthy. But we can also make incredible deals for the country so that that number will increase exponentially. I mean, this is a great thing.
Fund is about the lack of oversight. The Treasury having this unilateral authority to dole out all of this money.
Well, look, I'll be the oversight. I'll be the oversight. We're going to make good deals. We make good deals. But these companies need it, even if it was just a simple loan, which would be, but we can do better than that. And the companies are willing to do better than that. I mean, they got hit. Most of these companies, it was through no fault of their own. There are a couple where it was, they were troubled before they came in. We talked about one. It had trouble. Nobody can believe it, actually, in that one. But these companies are, through no fault of their own, they have difficulty. I mean, 2 weeks ago, these companies were among the most solid institutions in the world. You'd want to buy their bonds. Their bonds were rated AAA or whatever their highest rating is today. And now all of a sudden they have difficulty because they've been closed up. So you need something to keep them going. But that money is not going to be wasted money. That money is going to be seen, and we could multiply that number by many times coming back to the American public. That could be a phenomenal thing. But most importantly, it's going to keep these great engines of jobs and ingenuity going. Very important. Yeah.
Okay, two things there. One, who's going to be the oversight to all this money going out to companies? Trump will. He just told us he's going to oversee it. So are you relieved? Are you relaxed now? You can sleep well at night knowing that Trump is going to oversee a massive, massive amount of money going to these companies. He's going to take care of it. He's got it all under control. The second thing, the one that actually bothers me the most, is when he keeps talking about how these companies got in trouble through no fault of their own. We have to bail out these companies because they got in trouble through no fault of their own. That's not what we generally hear from that side of the aisle. When you talk about people going bankrupt because of their medical bills, which tend to happen through no fault of their own, that person should have made better decisions. That person should have been prepared. That person should have saved up money for when they have to go to the hospital. Well, what about that person needing a bailout for things that happen through no fault of their own? But when it's a corporation, all of a sudden we got to sweep in and save the day because it happened through no fault of their own, right? It just doesn't fit at all. We're treating the corporations better than we treat the actual people. And he's saying, oh, well, we have to have these corporations to help the people. Yes, of course. We need companies to keep people working. That's absolutely true. But why is it that we bail out companies who get in trouble through no fault of their own? But it is unthinkable, right? We could never afford as a country to help people who get into trouble through no fault of their own. Well, those are completely different. Yeah, because one's a human being. One is a human being. He doesn't see that. Okay, so that was a little bit of an insight into Trump's mind. So please subscribe to check out more videos. So that was a little bit of an insight into Trump's mind. A little scary, a little funny, a little serious. Lots of different things going on there. Please subscribe to check out more videos as they become available, and we will see you in the future.